Pocono Medical Center was recently ranked among the top 10% of hospitals in Pennsylvania by U.S. News & World Report. And PMC is leading the way with services such as the Advanced Wound Care Center. Joining me right now is Dr. David Meyer-Levy. He's a vascular surgeon here. And Doc, give us an overview of what the vascular system is.
Vascular system is the system of arteries and veins in the human body. So heart surgeons treat coronary artery disease. We treat the vascular system in the neck, the arms, the legs, and the abdomen.
And that, of course, can include then wounds. If people get injured and they have a wound, you treat that too.
Absolutely. And vascular surgeons have that unique training in knowing what makes the wound heal, because as in any kind of healing, the bloodstream is important to provide the nutrients and the oxygen to help in healing of the human body.
Now, normally if somebody gets a cut, normally they would most likely heal, but some people have a hard time with healing, and that is where this comes in, right?
That's correct, yes. The Wound Care Center is geared towards complex wound care.
Now, if you have a non-healing wound, what can you expect as a patient here?
In addition to the coordinated care that we can provide for the patient, we also provide them with a very thorough workup of the reason why they have developed an ulcer or why they are not healing the ulcer. And that can include what we call vascular testing. And vascular testing enables us to get an idea of how good the blood flow is in that particular part of the body where the ulcer occurs. We have an accredited vascular lab, which is very important in allowing us to provide quality care to our patients, not only in the wound care center, but also on the vascular side of our practice here. And we have two vascular technicians that are just specializing in those particular studies.
And so with everything right in this building, you really don't have to go anywhere else. You can come here and it's kind of like one stop.
That's correct, and many times we have patients that don't have a primary care physician, or where we see that they've had uncontrolled blood sugars for many weeks or months, and we are able to refer them to the appropriate specialist or source where they can either obtain information or even treatment.
Now I'm with Dr. Eric Wilson. He's the medical director here at the Advanced Wound Center. Doc, great to have you on the program. What is hyperbaric oxygen therapy?
Hyperbaric oxygen therapy is a way of increasing the oxygen delivery to tissues and then thereby also increasing the oxygen delivery to wounds. The way we do this is by placing patients in a chamber where we can give them 100% oxygen under pressure, and that allows us to dissolve the oxygen in the plasma and thereby deliver the oxygen directly to the tissues.
Who can benefit from this kind of therapy?
Patients with chronic wounds are the ones that benefit best, specifically diabetic patients that may have what we call microvascular changes, where the arterial flow to the areas where the wounds are is not ideal, and by dissolving the oxygen in the tissue plasma, we're able to get it into the area of the wound bed with a greater concentration.
What do patients experience inside one of these chambers? We have one open here right now, and it's open for demonstration purposes, but what do they experience when they're in there?
Well, we can go over and ask. Hi, Connie. How are you?
Good, doing good.
How you doing in the chamber?
Wonderful, no problem.
Great. That's wonderful. You warm enough?
I am.
Terrific. Thanks.
Now, Doctor, for our viewers watching at home, what is some of the best advice for keeping our vascular system healthy?
Sure. Well, the main 5 factors when it comes to arterial vascular system issues has to do with smoking, diabetes, high blood pressure, high cholesterol, and a family history is certainly very important. And unfortunately, that's the one we really can't change. But the other 4, we can have some impact on that. If there's smoking as an issue, then certainly smoking cessation has to be first and foremost. The other 3 have to do with chronic disease states, diabetes, high blood pressure, high cholesterol. And by managing those medically and keeping the levels at what the doctors are recommending, that's the best protection we have against artery disease.
To learn more about Dr. Wilson and Dr. Meyer-Levy and the expert wound and vascular services available at Pocono Medical Center, please visit poconomedicalcenter.org. The Advanced Wound Care Center is located at PMC Bartonsville Healthcare Center, Bartonsville Square, 600 Commerce Boulevard in Stroudsburg.